Hello and Happy New Year to all of you and to all those that you love. My name is Tim Ryley, I'm Chief Executive of Leeds CCG, and I wanted to take this opportunity to wish you all a very happy New Year. And I hope you've had a good break over the Christmas and New Year period with friends and family, and that you are all well, because at the moment that's quite a challenge, isn't it? But I hope nobody has been taken seriously ill over the last couple of weeks. I wanted to speak to you just a bit about the urgency of the situation facing the NHS in Leeds at this moment in time. So some numbers to start with. Currently, the COVID rate in Leeds is 1,200 people per 100,000. That's almost double the peak that we had in previous episodes. So as we expected, Omicron is highly contagious and is really affecting a very, very large number of people. That is a 66% increase on a week ago. In the 60 plus age group, which we watch more closely, is 466 per 100,000. That's a 190% increase on where we were a week ago. So you can start to see the impact of what's happening coming through from Christmas, and no doubt fairly soon coming through from New Year as well. So lots and lots of pressure, and that pressure is being transferred into the hospital as well. So we had 50 patients with COVID in the hospital pre-Christmas. It's now 231, and we're expecting it to go much higher over the next couple of weeks. So the situation is really serious for the NHS. And on top of that, as many of you will know and probably have experienced in your family and among friends and so on, the staff absence rate is also really challenging. We're seeing some parts of the system under incredible pressure, the ambulance service, for example, but all parts of the health and care system are seeing very, very high levels of staff sickness on what is already a very stretched service. So that's the challenge that we're facing. And you will have heard Number 10 announcing some redeployment of staff urgently, and that includes us in some ways as well. So we will start to look to redeploy staff over the next week. I expect this situation to last for 2 or 3 weeks, but many of you will be asked to support the vaccination programme, for example, marshalling and admin. We're having to move beyond the voluntary piece into actually asking teams to provide people to support that. So please expect that. Perhaps if you've got clinical training, we may well also, and you're clinically qualified and still registered, we will probably be asking some of you to go in and support and work with colleagues, clinical colleagues, to fill some of the gaps. So this is challenging. It's not something I've ever wanted to do. It's not our main job, but we are facing an emergency in our NHS right now in Leeds. We've not yet declared one of those critical incidents you might have heard about, but we don't want to, but we are incredibly stretched. So a really challenging time. I don't think it'll last for that long. All the indications are probably 2 to 3 weeks. But nevertheless, we are going to have to play our part in some way in managing what is a very, very challenging situation. Line managers and others will be talking to you in due course about how that might work in the detail. But I just wanted to speak to you about that. So in all that we do stay safe. Do support each other. Do take breaks when you can or when you need to. This is a challenging time for everybody. And as part of the NHS, looking to support people and colleagues across the city of Leeds, we will do what we can. And I look to you to play your part in that. Thank you.